Well, it's been a major problem for years in Baltimore, and now the city hopes to fight back against heroin addiction and the problems that come with it. Rick Ritter has more on the mayor's plan.
Well, heroin has killed more people in Baltimore than any other drug over the past 7 years, and the new task force will spend the next several months trying to turn substance abuse around. On the streets, inside homes, and all over the city.
This was an issue that has been persistent in our community.
Heroin continues to destroy families across Baltimore.
You cannot let them continue to poison the youth's lives.
In the works for months, the city's new task force now hopes to clean up what some call the heroin capital of the world.
It is a very, very challenging disorder.
Starting with local treatment centers.
I've asked that they provide recommendations for strengthening drug treatment options
while reducing overall substance abuse in the city.
The task force will also explore how to better engage the community and promote positive interactions in neighborhoods where treatment programs operate.
In 2013, 464 people died of heroin overdose in Maryland, an 88% increase from 2011. Officials estimate the number of heroin addicts in Baltimore at 11,000. The city task force will determine if that number is even higher.
They're dealing drugs.
A recent episode of Drugs Incorporated on National Geographic.
Lexington Market is one of the longest-running food markets in the world.
Estimates that number is closer to 60,000.
Whether we're talking about 10 or 11,000 or 60,000, and we're still losing too many people.
Too many in what the city says has been a problem for generations.
What's going to be very important is to have a full range of options and those options be effective.
And the task force already started meeting. They'll report back to the mayor's office next July. Rick Ritter, WJZ Eyewitness News.
And Baltimore Behavioral Health System will oversee the task force.
And you know, we're not just talking cocaine. Heroin is a growing problem in Baltimore City, and today the mayor announced a task force to help find better ways to treat addiction. She made the announcement today. The group will look at heroin use in the city and examine the current facilities used to help addicts. They'll also address concerns from neighbors who don't want treatment facilities right near their homes.
Our hope is through this work to identify best practices when it comes to treatment, as well as figure out from those providers that are living well in communities, what are they doing, so we can learn and spread that with the other providers as well.
The Heroin Treatment and Prevention Task Force will report back to city officials with recommendations for strengthening treatment, improving access to treatment, and reducing substance use. The mayor says she wants the task force to have a report for her by July, and then the next steps that will need to be taken.
At Baltimore City Hall today, the focus was on treatment of heroin addiction. The mayor's forming a task force to study how to better treat heroin addiction. The task force will determine the most effective way to allocate roughly $50 million in state and federal aid used for treating addicts in the city. The mayor says focusing efforts on helping addicts will make the city safer.
Simply put, there is no way to make Baltimore a safer and healthier city without an effective and coherent strategy against heroin use.
The city has about 20 methadone clinics.